try, you'll find there's no need to cry. In this place, you feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place, heal the world, make it a better place for you and for me and the entire human race. There are people dying if you care enough for the living. Make a better place for you and for me. If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joyful giving. If we try,
It is a beautiful, beautiful afternoon here in the studios of Odadee Radio. A top of the afternoon to you, all our fair-haired listeners. And guess what? Presec just won its contest against Kumasi High School and St. James Seminary. So it's a period of ecstasy on the campus. You should be here. It is a lovely scene. People are out there on the streets jubilating. I mean, this is not much of a feat for Presec as the kings of high schools in Ghana, in West Africa, in the world for that matter. This is not much of a feat, but like we would always say, you celebrate the small wins, and then the wars themselves would come and would tackle them with ease. So today, we would be discussing a very important topic. Over a long period of time, we've noticed that there are a lot of specialties in Ghana with regards to clinical medicine. One of them, a long-standing specialty for that matter, anesthesia. I'm sure you may have heard about one way or the other. Probably for anyone who may have had surgery, you would have been told that go for anesthesia review, go to the anesthesia clinic, or go speak to your anesthetist. What exactly do anesthetists do? What do anesthesiologists do? What does the clinical specialty of anesthesia entail? And what is their role in clinical medicine and academia, especially in modern times? My name is Dr. Anafo Awuni Godwin, and I will be your host for today's enlightening, educative, and informative session of Ɔdadeɛ Radio. Like we do, we throw more light on all the topical health issues that continue to plague our society. In the studios with me is an elegant guest in the person of Dr. Rachel Osei. Dr. Rachel Osei is an anesthesia resident with the nation's premier hospital, Korle Bu Teaching Hospital. And she will be here to enlighten, she is here, I should say, to enlighten us on the role of anesthesiologists in modern medicine and academia. Dr. Rachel Osei, a good afternoon to you.
Afternoon.
You are welcome to the studios of Ɔdadeɛ Radio.
Thank you so much.
Yeah. How is the feeling like? How's your afternoon?
It's been okay. It's been cool.
Oh, thank God. Thank God. Yeah, just before we get into the conversation, I would want to get to know a bit more about you. I mean, we've worked together in Korle Bu Teaching Hospital, but for the benefit of our cherished listeners, I would want you to give them a little background about yourself. We'll try as much as possible to concentrate on your high school education, since this is a high school radio station.
Okay,
Yeah.
so as you said, I'm Dr. Rachel Osei with the Department of Anaesthesia, Korle Bu. I've been there for about 2.5 years now. So for my secondary school, I went to Wesley Girls High School, Cape Coast.
Oh, Wesley Girls.
Yes.
Let me see if I can remember the motto. Live pure. What
Yes, that's the
exactly?
first
Okay,
line.
live pure,
Yeah.
speak true,
Yes.
right wrong, follow the king.
Yes.
Live pure, speak true, right wrong, follow the king.
Yes.
Were you able to follow the king in your last contest in the National Science and Maths quiz? Oh, you're not able. That's fine. I mean, Wesley Girls is a great school. It's just that they are not able to match us boot for boot when it comes to the National Science and Maths quiz, but they are a great school. I mean, I would have to admit, having worked with her, I know her work ethic, how intelligent and smart she is, and I mean, all that is partly due to the high school that she attended. Okay, Wesley Girls High School.
Yes.
How was your experience there like?
Yeah. It was interesting. I was involved in a few activities. So I was a track and field athlete
Whoa!
at my house.
Wow.
So I did 100 meters, 4 by 100 and 200 meters.
Excellent.
And I got onto the school team, but I didn't participate actively in the inter colleges and then the super zonals, but at least I was in the team. I did all the training and all that. And then I was also in the school choir as well, as a soprano singer.
Oh, that's impressive.
Yes.
Do you mind giving us a rendition of your school anthem? Okay, let me not put you on the spot. Dr. Rachel Osei can be shy from time to time, but a very, very diligent medical doctor, intelligent one at that. And as you can see, she's one who's had holistic education. She was not just in Wesley Girls High School for the books alone. She was part of the track and field team of Wesley Girls High School. Impressive. And I'm not surprised looking at your physique. She's pretty tall. How tall are you?
1.77 meters.
Oh, 1.77. That's
like
impressive.
5 feet 9
5
inches.
feet 9 inches. That's impressive. Okay, so we'll get straight into the conversation. I don't know if you want to talk about family, because Mr. Eddie Kofi, one of our executive producers, would be pretty interested in your family as well. So
Yes.
just give us, a peek into your family.
I'm the first of 3 children.
Okay.
So I have a younger sister and then a younger brother.
Okay.
And I live with my mom. Yes, my dad was a doctor as well at Kolebu.
Okay.
He was into immunology.
Okay.
Yes.
Okay.
My mother also works at Kolebu. She works in the medical school in the community health department.
Lovely woman. Yeah.
Yes. So that's basically it.
Yeah. Yeah. So Mr. Eddie Kofi, our executive producer, knows Rachel inside out. Rachel's mom was Mr. Eddie Kofi's basic schoolmate, right?
And I think they live in the same area.
The same neighborhood.
Near each other, yes.
Wow, such a small world. Yeah, so that is it about Dr. Rachel Osei. She's no stranger to us, the Odadee medical fraternity, at all. So we'll go straight into the discussion. But before we do, I would want to remind you, Odadee Radio, and for that matter, Odadee Health Matters, is a very interactive show. We care about your comments, we care about your views. We would want to answer your questions. So all you need to do is send us your questions, send us your comments, send us your views. We are ever ready to answer them. And you can interact with us on our various social media handles. You can contact us on Facebook at Odadee Radio Ghana. You can also reach out to us. You can also reach us on Twitter at Odadee Radio, and on Instagram we are at Odadee Radio. That is where all the juice is. That is where we inform, we educate, we enlighten, and we illuminate. And of course, some of the blue magic would rub off on you if you follow us. Right. Okay, so let's go straight into the discussion. Anesthesia. What exactly is anesthesia?
So anesthesia actually means loss of sensation or awareness. So we deal with, so when you're having a surgical procedure, so we make it safe and possible for patients to have surgery. So we have 3 aspects that we deal with. So we deal with analgesia or loss of pain, and then muscle relaxation so that the person can be very still as possible for the surgery. And then what we call amnesia or loss of memory, so the person doesn't remember the experience of the surgery, because it can be quite traumatic to remember that you saw them like opening you up or something like that. Yes. So anesthesia rotates around these 3 parts. So we take certain aspects of it. Sometimes all of it is involved. That's when people say you've been put to sleep. So the person will remember anything, will not feel pain, and they'll be completely still. Or we just deal with particular parts of it. So if the person doesn't need to be asleep for the surgery, such as the pregnant women when they go for the cesarean section. So in that case, the person is awake all right, but they just will not feel the pain of the surgery or the sensation. Yes.
Okay.
Yes.
So the anesthesia basically revolves around these 3 central themes.
Yes.
Loss of pain, that is analgesia, so loss of pain and sensation.
Yes.
So they don't feel any pain, they don't feel any sensation at all. And then you also relax their muscles.
Yes.
And then you provide amnesia so that they do not remember the traumatic experience
of the surgery.
That is impressive. So basically we could say that you kill them temporarily.
Yes, sort of. So that's mostly for the general part. So then there are different parts of anesthesia. So there's general anesthesia, that's where people say that I slept and I woke up and I didn't before I realized the surgery was over.
Okay.
And then we have what we call regional anesthesia. So that only involves a part of the body.
Okay.
And usually the person is awake for
Okay.
that.
Okay.
Yes. And then we can also give what we call sedation. So the person is sleeping all right, but they are still breathing on their own. It's kind of like they've gone to bed and they are just sleeping or relaxing. Yes, we also do that.
That is really impressive. That's really impressive. I've actually heard some anesthetists say they are cute enough to. Can you complete that for me? Because I think you are cute enough to put someone to sleep or to what? To kill them and then
and to wake
skilled
them up.
enough to wake them up. Oh, that's impressive. That's impressive. So that's what anesthesia is. We've come across quite a number of these terms being used interchangeably. Anesthesiologist, anesthetist. It's quite a mouthful, right? So I often have to take my time. Anesthesiologist, anesthetist.
Yes.
Is there a difference between the two?
Yes. So an anesthetist is like the general term
Okay.
for those who provide anesthesia, because it's not only us doctors who give anesthesia.
Okay.
So an anesthesiologist is a medical doctor who has specialized in anesthesiology.
Okay.
Yes, because nurses can also give can be trained to give anesthesia,
Okay.
but they are called certified registered anesthetists.
Okay.
So they come under anesthetist as well. So anesthetist is like the general term. So
Okay.
either a nurse or a doctor who is giving anesthesia. Then anesthesiologist is a doctor who has specialized. He's gone to medical school, has completed, and now he's specialized in the field of anesthesiology.
So basically, anesthetist is the umbrella term
Yes.
that encompasses both physicians and the nurses who have been trained to
Yes.
administer anesthesia. That is great. You already mentioned that anesthesia revolves around 3 central themes, if I get it right. So beyond making patients unaware or unable to feel pain during surgical procedures, what other roles do anesthesiologists play in the clinical setting and in academia?
So in the clinical setting, so the backbone of anesthesia is patient safety.
Okay.
So we are very concerned about whether the patient will be safe having the during the procedure being done or not. In the clinical setting, we also look after the critically ill patients. So those who have been sent to the ICU or those who would need to be sent to the ICU, we look after them. We go and see them on the ward, and then we, if possible, we have them sent to the ICU, and then we look after them. When they are well enough, they are usually discharged to the ward that they came from. Yes, and then we also look after. So during the COVID times, we were mostly the ones manning the critically ill patients.
Okay.
Yes, and then also we manage pain as well. So some people have maybe for one reason or another, they have like this chronic pain, this pain that's never really goes away. So they also come to the pain clinic as well, and then there are specialists, anesthesiologists there who manage them as well.
That's quite broad. I mean, I had always thought.
Yes, so people tend to think that we are just in the theatre.
Yeah.
We just sit on our phones and then that's it. When the surgery is over.
Sitting behind the curtain.
Yes, yes.
But that's impressive. So beyond, just providing analgesia for surgical procedures, it means that with critically ill patients, you're always the ones to take care of them. In the ICUs, in the high dependency units. I mean, I'm sure there are other...
So for Kolebu, we look after the critically ill patients for the Department of Surgery.
Okay.
And then obstetrics and gynecology.
Okay.
So the other departments also have their ICUs. So like medical has their ICU, so they man, and etc. etc.
Okay.
And if they think they need our help, they'll contact us and then we'll see what we can do. But we are mostly at the surgical ICU.
The surgical ICU.
And then the obstetrics ICU
as well. And I think the plastics ICU, they also
sometimes
call upon you from time to time.
Yes.
That's impressive. Basically, you work in every department in Kolebu.
Yes, sort of. So, we have to know a bit about different departments.
Wow. That means that you actually have to be well grounded in your basic sciences and in all other fields of medicine.
It's a very technical specialty because of the nature of our work. We have to really study things into detail. Yes, because it's quite it's quite a volatile profession. Yes, but once you know what you are doing and you are being supervised and you are learning the correct thing, it's everything. Hopefully, everything goes well. Yeah.
That's impressive, I would have to admit, because I actually have a friend who once stated that if you're in Kolebu Teaching Hospital and then any specialty runs into trouble, the first point of call, the first physician to always call is the anesthesiologist. And I mean, having worked there myself, I would have to agree to this, that at any point in time, be it an obstetrician, a gynecologist, an internist, a surgeon, whoever it may be, when they run into trouble and they need a patient back to life, it's always the anesthesiologist. It's such a wide array, and we need to know more about this, because a lot of people actually think an anesthesiologist, all you need to do is go give spinal anesthesia, and then women give birth via cesarean section, and that is the end of the story. But I mean, this is quite holistic, I would have to admit. Okay, so having known about what anesthesia is, the difference between an anesthesiologist and an anesthetist, and then also gone further to let us know the other roles that you play in clinical medicine, I want us to take a sneak peek into your day as an anesthesiologist. When you get to work, we want to know, what exactly do you do? What is your routine like? You know, just give us a sneak peek into the life of an anesthesiologist.
So it depends on where you are placed. So we are, before the month ends, we get the rota for the next month. So you either be in the theatre or in the clinic or in the ICU. And then Mondays and Tuesdays we have our morning meetings. So that's where you will go first. Then afterwards you would go to your station. So for the theatre patients, you would have seen them the day before. After you've closed from your previous day, you wouldn't go straight home. You would go and see the patients for the next day in the ward. Make sure that everything is ready. Everything is ready for the patients to have the surgery. And then in the morning, you just go and see them at whichever theatre you've been stationed at. And then depending on their difference, and depending on which one is going first, so that there's a list. So
a list of patients.
Yes, for the
surgery.
day. Yes, and then also the surgeons decide which patient to be done first and all that. Yes, so after that has been decided, then you would send the patients when the theatre is. So when you get to the theatre, you'd have to make sure that everything is ready. So you have the anesthesia machine. You check it, make sure your drugs. There are certain drugs called emergency drugs which we use when we run into trouble. So you make sure they are there. And then you make sure everything else, other things like the suction is functioning. Then when you're ready...
What is suctioning?
So suction is when, sometimes when you're under anesthesia, the mucus and things in the air, in the throat...
Sort of secretions?
Yes, secretions, yes. They will come up and then you have to use a machine to suck them out so that you don't have the chance of the patient breathing in and getting pneumonia.
Okay, so if they breathe in the secretions into their lungs, they can have adverse effects such as pneumonia.
Yes.
Okay.
So after all that is ready, and the surgeons and the theatre nurses are also ready, they've set up, they are ready. Patient is sent in, then patient is put on the bed, and then everything is you just make sure that everything is ready. And then you would give the anesthesia depending on which one you are doing. So then when you've given the anesthesia, and then let the surgeon know that you've given the anesthesia, then they scrub in, so they become sterile to make sure they don't give any infections to the patients. And you will sit with the patient throughout the surgery. And then at the end, you would have to make sure that the patient is, should I say, not to say well enough or something like that for.
Yes, but stable enough to be able to
be sent to the ward,
to the recovery ward first.
Yes, so we have a recovery ward. We don't go straight to the ward because we've given them some drugs and we've put them in a different states than normal. So you have to make sure that whatever we've done to them is no longer active in their systems. So that before they go to the ward, because we don't want them to run into trouble on the ward, then we now have to be called to come and deal with the patients. So that's for the theatre. So for the ICU, you're just there for the whole day. You see the patients who are already there. You review them. We discuss. We decide the plan, and then you'd also stay in the ICU the whole day, unless so those are the ICU. They also receive calls from other wards where they would want us to come and have a look at a particular patient who, what we say, is not doing well. So maybe they are not breathing well enough, or their awareness level has come down. Yeah, so we see patients around the hospital as well when we are called, and then we make the call and decide whether the person should be sent to the ICU or not. If yes, then we send them to the ICU. We transport the patient to the ICU, we receive them, then we set them up, settle the patients, decide on our plan, and then we look after them.
That is quite a busy day.
At the clinic, so if you are at the clinic, that's what we call the pre-operative clinic. So that's where we are seeing people who are coming for planned surgeries, what we call elective cases. So they have to be seen by us because we want to make sure that any problem they have which will interfere with our anesthesia, if possible, can be dealt with before the person comes for surgery. Because since we are thinking about patient safety, we like to anticipate problems that could come up before the person comes for that surgery, so that we can put measures in place to make sure that everything goes as smoothly as possible. So you would be there from morning till afternoon, till when you see the last patients. And then after that, depending on where you'll be the next day, you may go home, or you might have to go and see patients for the next day if you're at a theatre. Yes. Okay. So that's typical. And then we usually work, so for Kolebu, you do one duty day. So if you are on duty, that means any emergency case that comes up, we are the ones that will give the anesthesia for the surgeons to be able to operate. So that one too, it depends. You may be sleeping in, you may not be sleeping. So you may be doing a night shift. You may not be doing a night shift. Yes. Yeah,
it brings back memories, doesn't it? Yes, it brings back memories. Yes. But it's a lovely family. I mean, the anesthesia family is a lovely family. I got the opportunity to work with them for some time. And yes, it may seem like I'm feigning ignorance of the department, but it is a lovely, lovely family. I totally enjoyed my time there. And I can see that it is a full day. I mean, you are not just thinking about doing the surgery, but basically you are concerned about the safety of the patient. So you are working on the pre-operative aspect, working on the intraoperative aspect, and working on the post-operative aspect. So apart from seeing the patient in surgery, you'd actually really want to see them before surgery,
and after,
during surgery, after surgery, and sometimes even after they've been discharged.
Yes.
That's impressive. Of course, that's for the chronic pain patients who often come back. Yeah. That's impressive. That is impressive. I mean, we are discussing the role of the anesthesiologist or the anesthetist in clinical medicine, especially modern day medicine and academia. And I may not have mentioned this from the very outset, but the anesthesia department, especially in Kolebu Teaching Hospital, has a lot of Odadees. Right? Has a lot of. The current head of the department, a big shout out to Dr. Odadee. Dr. Odadee is an Odadee, proud old boy. I think the one who handed over, the head of the department who handed over to him, Professor Anitei, right? Professor Anitei is an Odadee. Notable mentions to all the Odadees there. Let me see if I can remember all of them. Dr. Kowa, Dr. Nefi, Dr. Kwame, Dr. Jamira, Dr. DeGraft Johnson. I mean, there are quite a lot, aren't they? Yeah. And what do you think of them?
Oh, I think they are very nice people to work with. I personally don't have any issues with them.
Are they gentlemen?
Yes.
Did they treat you right?
They do.
They do? Did I treat you right when we worked together? Oh, you are free to say anything.
You did.
Yes, the anesthesia department, I mean, it would need to be manned by brilliant minds. It would need to be manned by people who pay attention to detail. And where else can you find brilliant minds that pay attention to detail other than the Presbyterian Boys Secondary School? And the reason, I mean, we have the likes of Professor Anitei, Dr. Odadee, Dr. Kowa, Dr. Nefi, Dr. DeGraft Johnson, Dr. Kwame. The list goes on and on. And of course, notable mention to all the others who attended other schools, Dr. Rachel Osei of Wesley Girls High School, Dr. Pupulampu, Dr. Kote, Dr. Kwakopom, right? And Dr. Bafuiwa, my very own sister, right? Yeah, I mean, anesthesia is a great, great place. If you are just tuning in, this is Ɔdadeɛ Radio. This is Ɔdadeɛ Health Matters live on Ɔdadeɛ Radio. And it is a beautiful afternoon here in the studios of Ɔdadeɛ Radio. We are discussing the role of the anesthetist in modern day medicine. We want to go for a quick commercial break just to acknowledge our sponsors who have held us down, who have supported and helped us throughout our establishment, and of course using this opportunity to speak to you all out there. If you have any services, any goods, especially medically related, that you'd want to advertise, this program is viewed and listened to by a lot of people. So you can often bring your products, you can bring your services, and we'll advertise for you at very affordable rates. This is a clarion call to all Odadiers who want to advertise their products, who want to advertise their services, and also to any person at all. You don't have to have attended pre-sec. So Dr. Rachel Osei, if you have any business, you're welcome to advertise it on Ɔdadeɛ Radio. And
Thank
we'll
you
do the
very
publicity for you, we'll illuminate your business and make the world know about your great services. Don't touch the dial. We would be right back.
Make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me.
Ɔdadeɛ Radio. Like us on Facebook at Ɔdadeɛ Radio. Follow us on Instagram and Twitter at Ɔdadeɛ Radio. You can WhatsApp or call us on 0200 092925.
Did you know that 90% of people with autoimmune diseases will be misdiagnosed or spend years before a diagnosis is made? Precious time that could lead to organ damage. Autoimmune diseases occur when the immune system starts to attack healthy organs and cells in the body till they are destroyed. These conditions are more severe and are increasingly seen in people of African ancestry. The Rheumatology Initiative TRI is an NGO leading with education, advocacy, and research in autoimmune diseases. TRI ensures patients have the right peer support with a support group of over 200 people diagnosed with autoimmune conditions. The Rheumatology Initiative provides emergency medication for needy patients and teaches them life skills to ensure some financial stability. TRI reaches patients, health practitioners, and the general public through various educational interventions to enable prompt diagnosis and treatment for improved outcomes. How can you support our work at the Rheumatology Initiative? Please donate to our MTN Momo 024 192 9775. Account name is the Rheumatology Initiative. To volunteer, please send an email to volunteer@tryghana.org. That's TRIGhana.org. Visit our website tryghana.org to reach us, and on social media look for our handles at TryGhana.
There's a place in your heart, and I know that it is love.
Say no to single-use plastic bags. They are destroying our environment. Water bodies contribute to most of the rubbish in open spaces and gutters, contributing to floods. Fish and livestock are ingesting plastics, which poses danger to our health. Plastics take ages to decompose and are harmful to the environment. Be responsible. Join eco-conscious citizens in supporting International Plastic Bag Free Day and say no to plastic bags. Use a basket, jute bag, or other biodegradable bags on 3rd July and every other day.
You are listening to the live streaming of Ɔdadeɛ Radio. May I please have your attention for this announcement? Are you an Ɔdadeɛ? Are you looking for that opportunity here on Ɔdadeɛ Radio to reach out the many Ɔdadeɛs out there? Let your schoolmates and your targeted clients know of your products and services. Here on Ɔdadeɛ Radio, we shine the light on all that Ɔdadeɛs are involved in across the globe. Come and support us, and let's reach out to all Ɔdadeɛs through our medium to know your business and services. To all Odadeers and other stakeholders who wish to offer their support to Ɔdadeɛ Radio should please call or WhatsApp us on 0200 29295 or call us on 030 255 1014. You can also reach us on our social media platforms at Ɔdadeɛ Radio on Facebook, Instagram, and Twitter. Send us an email at odadeeradio@gmail.com or visit our studio at the Presec Alumni and Mentorship Center AMC on the Presec campus, Legon, Accra. Ɔdadeɛ Radio, shine the light. Thank you for your attention, and please stay glued to Ɔdadeɛ Radio.
Hi, this is Patricia Obonai, Global Vice President. Keep listening to Ɔdadeɛ Radio.
There's a place in your heart, and I know that it is love. And this place is much brighter than tomorrow. And if you really try, you'll find there's no need to cry. In this place, you feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place, heal the world.
Hello and a good afternoon to you. If you are just tuning in, this is Ɔdadeɛ Health Matters live on Ɔdadeɛ Radio, the first and only high school radio station in Ghana, and I think in West Africa too, if I'm not mistaken, possibly in Africa. Yes. I mean, Presec, we always set the standard, we always set the pace. We have a student of Wesley Girls, an old student of Wesley Girls High School in our midst, who's been educating us on the role of anesthetist. That's quite a mouthful, so I often have to take my time. The role of anesthetist in modern medicine and academia. My name is Dr. Anafo Awuni Godwin, and I am your host for today's enlightening edition of Ɔdadeɛ Health Matters. So Dr. Rachel Osei has been educating us. She's told us what anesthesia is. She's been able to help us make the distinction between an anesthesiologist and an anesthetist. She's given us a sneak peek into her usual day as an anesthesia resident with the nation's premier hospital, the Kolebu Teaching Hospital. And we mentioned some of the names of anesthesiologists currently in the Kolebu Teaching Hospital, actually manning the place. Dr. Odadee, current head of department, Professor Anite, past head of department, Dr. Osei, also of Kolebu Teaching Hospital, Dr. Kwame, Dr. DeGraff Johnson, Dr. Jamira, Dr. Kowa. I think Dr. Kowa was one school prefect, if I'm not mistaken. Yes, okay. Dr. Nefi. I mean, there are a lot there, and they are manning the wonderful department of anesthesia, and they are doing an excellent job while at it. Yes, Dr. Rachel says, so we want to continue. You've done a great job educating us thus far. I want to get into the patient aspect. You've been mentioning safety. It looked like you are patient-centered. So I want to know, what should patients expect when coming for anesthesia clinic or review? I'm sure many of them, when they're going for surgery, they are told, please go for anesthesia clinic or go and see an anesthetist before your surgery. What should these patients expect before they come to you?
So with the surgeries, there are different types. So we have the emergency surgery, and then we have the elective surgery. So elective surgeries are planned surgeries. So that is where the surgeon would have seen them at their clinic and all that, and then they would give them a referral letter to come for anesthesia review, and they'll write some lab tests for them, and then some other what we call investigations, so imaging and all that before they come.
What imaging means?
So imaging, so example like chest X-rays, CT scans, sometimes what we call echocardiograms, and then ECGs and other
Okay.
Yes.
What's the rule? Is it really necessary for a patient to spend money doing all these things?
Yes, because so when they come to the clinic, we have it's like a form that we follow.
Okay.
So it asks them various questions, so such as the type of surgery they are going to have. So apart from their details like the name, age, and sex and all that, so it's asks the type of surgery they are going to have. So so the aim of the coming to the clinic, this is for the elective surgeries or the planned surgeries, is to get to know the patients before to get to know the state of the patient who is coming for that surgery, and to decide whether the patients can have the surgery or not. If there are some problems that need to be sorted out before the surgery is done, we would see the person, we would give our assessment, we would do our assessments, we would write our plan down. Then sometimes they have to go and come. I know it's a bit tiring for the patients, but if we don't do these things, we can run into problems on the theatre table, which could have been avoided before if the person had been seen thoroughly and then had been managed. So they would come with the labs, with the lab test and the imaging that their surgeons have written, and we ask them things about their anesthesia history. So have they had any anesthesia technique done before?
Okay.
And how they reacted to it. Did they have any problems? Did they have any like drug allergies or things like that? So that the next person giving the anesthesia has an idea that this person has this problem. So maybe they have to avoid certain drugs that we would give for the anesthesia and look for an alternative. And we also ask about their what we call past medical history. So there are certain conditions we ask about, like hypertension, diabetes, sickle cell, and things like that. Because they each have their way of being managed by anesthesia to make sure the person doesn't run into problems.
Okay.
And then we also ask if they are taking any medicines as well, because some of the medicines can interfere with the drugs that we give. So there are times where, I'll take an example of hypertension. So some people, two people may have hypertension, but they're on completely different drugs. Some drugs have to be stopped on the morning of surgery because they can interfere with our drugs, while other ones they can continue taking them. Yeah, so it's important to us to know what medicines they are taking, so we can decide whether the drugs have to be stopped or not, and we can decide whether this drug is going to interfere with our anesthesia. If it does, what is going to be done about it? So some people, a few problems we tend to have is that some people don't know the medications they are taking.
Yeah.
So they come and then they have to go and come with the medications.
Okay.
Yes. So it's advisable that if somebody is coming to anesthesia clinic, they come with all their medications, because we know some of the names are a bit long for them to remember. But if we see the drug, then we have an idea of then we'll know how to go the way forward for them. And then we also ask about drug allergies, because drug allergies are very important. Unfortunately, with medication allergies, there's no way of testing. The only way you know is if it's taken. Yes. So if somebody's allergic to a particular drugs, often it's some antibiotics like the penicillin and all that, the amoxicillin. So we will get to know, so that we can make sure that it's not given during the surgery. And then we also ask about blood as well. So since it's a surgery, the person can bleed.
Blood. Okay.
Yes, and that is a whole long process. So we they tend to prepare some blood before going for surgery. But there are some people like seems the Jehovah's Witness who don't accept blood transfusion. So we have our way of managing them as well. So we ask them, are you okay with receiving? If not, then why? Then they have a way of managing them. Then after we've asked these questions, we'll then go on to have a look at them. So we would do a head-to-toe assessment as usual. Like when they go to see their doctor, and their doctor has a look under their eyes and then listens to their chest and all that. But we have in addition what we call the airway.
Okay.
Because that's all part of the general anesthesia, where I'm sure people were told that they've heard that they put a tube in their mouth, and then connected to what we call a ventilator, which breathes for them. Yes. So we have particular things we look at as well, and that's something extra to the normal assessments. Yes, and then afterwards we look at the labs and then the imaging. So depending on the surgery, and then if the person has a condition like hypertension or diabetes, there are specific labs we look out for. And then if the person doesn't have it, sometimes either they have the lab and it's old, so it has to be redone, or they just don't have it. Yes, so that's where we tell them to go and come. It looks like it's a bit tiring, but it's all in the best interest of the patient. And then we have protocols as well we follow, where you have to do certain things. If you don't do those things, we become liable to we'll be in trouble.
Medical legal issues.
Yes, we'll be in trouble. Yes. So after all of that, then we come up with our problem. We write a problem list, and then we write our plan. Yes. So if everything is good, then we tell them that the person can have the surgery done. And then the surgeons, to Kolebuna, we use the computer system. So the surgeon will see our plan, and then they'll also make their preparations as well. So that's for the clinic aspect. So that's what we call the pre-operative clinic. So Kolebu's one runs on Monday, Wednesdays, and Fridays.
Mondays, Wednesdays, and Fridays. So at the heart, if I'm getting you right, at the heart of anesthesia is safety. So safety first. And so all the complex procedure that patients would often have to go through before they are cleared for anesthesia is in their own interest, to ensure that they have a successful surgery, not just a successful surgery, but that they are able to live their normal lives after the surgery.
Yes, and then also, and also the clinic is also there to for us to decide what type of anesthesia we're giving. So whether it's what we call a general anesthesia, where the whole body is affected, and the person has been put to sleep, and then we have other types of as I mentioned earlier, that's where we also get to decide what type of anesthesia is going to be given. And so that's for the elective part. Then the emergency parts, with that one, there's no time to prepare. So say normally someone that's been involved in an accident and then they need a surgery. So we have a quick way of assessing them. The surgeons will get the patient ready for surgery. Then when they come to the theatre, we do our own quick assessment as well. So in that case, there was really no time to prepare. They won't go to the anesthesia clinic.
But you'd still stabilize them first before they go into surgery.
Yes.
Okay. That makes a lot of sense. I mean, any patient who would probably be asked to go for anesthesia review or clinic would now understand why their surgeon asked them to go through that complex process.
If we don't give the go ahead, the surgery cannot take place.
So I often hear that the relationship between surgeons and anesthesiologists can sometimes be a strained one, but they are the best of buddies too, as I've noticed time and again while working in Kolebu Teaching Hospital. While on the issue of medical legal issues and trying to know about patients and all that, what is the relationship between anesthesiologists and patients like? What are the rights of the patients? I would want you to probably educate our patients out there. What are some of their rights? What should they inquire of you when they come?
So when they come to us, they can ask us about so we would tell them the different types of anesthesia options that are there, and they recommend one. Usually for the regional ones, if they are not okay with it, we can't do it when we have to do a general anesthesia. And then we also have to make sure that they've consented to the surgery first. So that's from the surgeon's part. And if the person is not in the right frame of mind to make that decision, then we have to see consent that the person who is in charge of the patient has made that decision as well. And they can also ask us, we also tell them the type of anesthesia we are giving, and then we tell them the process that we'll go through. So they'll understand that. So on the day of the surgery, they'll, when we are asking them to do certain things, like on the theatre, they like to sit up and all that, they already aware of what is going on.
Yeah.
It helps to reduce their anxiety levels, and then it's also it makes them a bit more relieved that this is what is going to happen to me, because to be in the theater room, it's a bit scary for a patient. We work in the theater, so we are used to it, but they are not. Yes.
Totally.
And then they can ask any questions relating to the anesthesia that they want. And if they don't want to have the surgery or the anesthesia done, then we cannot do it for them. Okay. So that's mostly from the medical legal part
aspect of it.
Yeah.
Yes. So patients out there, individuals out there, non-medical people out there, you've heard it from Dr. Rachel Osei. You have a right and you have a responsibility when you go to the hospital, including a right to inquire of your anesthesiologist what procedure is going to be done for you. The anesthesiologist would offer you the options available, and then you make an informed decision. It is your right to ask, to know what is going to be done for you, how it is going to be done, what the options are, and what you can choose. It is also your responsibility to know. Even as you have rights, there are also responsibilities that are expected of you. So even if you don't remember your medications, it is your responsibility to carry them along when you are coming for anesthesia review, or even when you are going to the hospital. Try as much as possible to remember the names of your drugs. Try as much as possible to remember some of the medical conditions that you may have, any drug or food allergies, if you would consent to blood or not. These are responsibilities that are expected of you when you get to the hospital. Even as you enjoy the rights of a patient, you're also entreated to know your responsibilities. You help the doctor to help you. You help the doctor to make you make an informed decision. Yes, if you're just joining us, this is Ɔdadeɛ Health Matters live on Ɔdadeɛ Radio. My name is Dr. Anafo Awuni Godwin, and Ɔdadeɛ Radio, and for that matter, Ɔdadeɛ Health Matters is a very interactive show. You can listen to us via our radio app on the Zeno FM /Ɔdadeɛ Radio. You can download it on Google Play Store or on App Store if you are using an iPhone or an iOS device. You can also interact with us. We love to interact with you. We want to hear your comments, your views, your suggestions, and any other questions that you may have. So you can connect with us on Facebook via Ɔdadeɛ Radio Ghana. On Twitter, you can connect with us at Ɔdadeɛ Radio, and on Instagram, you can connect with us at Ɔdadeɛ Radio. Like I said, we've been with Dr. Rachel Osei, who's been educating us, has been enlightening us, and has been throwing more light on the role of anesthetists in clinical medicine and academia. We would want to go on a quick break. When we come back, we'll round up, and then if there are any questions from our listeners, we'll take them and then wrap it up. Stay tuned, don't go anywhere.
There's a place in your heart, and I know that it is love. And this place is much brighter than tomorrow. And if you really try, you'll find there's no
Ɔdadeɛ
need
Radio.
to cry.
Like us on Facebook at Ɔdadeɛ Radio. Follow us on Instagram and Twitter at Ɔdadeɛ Radio. You can WhatsApp or call us on 0200 092925.
Agriculture plays a crucial role to our country's development, with a huge contribution to Ghana's GDP, whilst providing for our food needs at the same time.
They should know that agric is the backbone of every country. Honestly, you began by giving us the percentages, but it used to be 70% that agric contributes to the economy. It's because of certain lapses that has made a figure decline.
I don't know why they see farming as a bad occupation, because in other developed countries, they take agric very seriously and they make a lot of money out of farming. They use a lot of modern technology to improve their yield, but over here we only see it as the use of certain man-made or small implements such as cutlass and hoe, which don't really do much. If you want to go into mass production, which will bring you a lot of money, you use a lot of modern technology that will help improve the yield.
Time to put the spotlight on agriculture value chain in Ghana on Agric Panorama on Ɔdadeɛ Radio. Agric Panorama is a radio program that is aimed at creating a unique platform for all farmers farmers, traders, processors, transporters, wholesalers, and all other actors within the agric value chain. Agric experts, policymakers, students in agriculture, and other stakeholders as they participate in a panel discussion to unravel all that matters to improve agriculture and agribusiness sector, which is the backbone of Ghana's economy.
It's beneficial to the country in the sense that the non-companies in this country, the products these companies bring out are from agric, or the raw products are from agric, which has been processed into finished goods.
With agric, as I was coming, I wanted to do biology, but my grandfather was the person who told me that, why don't you try agriculture? Because I'm a farmer, and look at where I am. So you can also try agriculture, and then you can see how far you go.
Agric Panorama will be broadcast live from the studios of Odadee Radio Online every Saturday from 10 a.m. to 12 noon. You can listen and contribute to this program via the Zeno FM radio app or Odadee Radio app from the Google Play Store or App Store. Also watch it live on YouTube or Facebook at Odadee Radio or Odadee Radio Ghana. Odadee Radio, shine the light.
What does the Bible say? And what sort of light does it throw on any life-related issue? John chapter 1 verse 5 states, "And the light shineth in darkness, and darkness comprehended it not." Light for Life is a Christian panel discussion program on all life-related issues and how the Bible helps us in its day-to-day application. Beloved, my name is Reverend Gordon Kwashi, and I invite you to join me and my guests on the Light for Life program on Odadee Radio Online this and every Sunday from 6:30 p.m. to 8 p.m. I trust that as we engage in this Light for Life program, we'll all be able to say to our God, "In thy light we shall see light." God richly bless you as you tune in.
I don't know what I would do without him. Whom shall I fear? Feel there's no hurt or sorrow.
Ɔdadeɛ Radio. Like us on Facebook at Ɔdadeɛ Radio. Follow us on Instagram and Twitter at Ɔdadeɛ Radio. You can WhatsApp or call us on 0200 092925.
Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for living, make a better place for you and for me. If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joy.
You are welcome back. If you are just tuning in, this is Odadee Health Matters live on Odadee Radio, Ghana's first high school radio station. I think West Africa's first high school radio station, and I suppose Africa's first high school radio station. Today we are discussing the role of anesthetists in clinical medicine and academia. My name is Dr. Anafo Awuni Godwin, and I am your host for today. We have in the studio Dr. Rachel Osei, who's been educating us and enlightening us on the role of anesthesiologists and anesthetists in modern day medicine and academia. Just before we went on the break, Dr. Rachel Osei, I think there was a bit more you wanted to add with regards to the information you'd often give patients prior to their surgery. So if you can conclude on that, then we'll continue.
So apart from telling them, detailing what we are going to do for them, we also tell them how to prepare for surgery. So at what point will they stop eating, if there's any medicines they have to take on the morning of the surgery, and also to get blood ready as well if it is needed.
Okay.
And then and then they go home, and then when they are cleared for surgery, the surgeon gives them a date. So we are not the ones who give the dates, because we are not the ones who are going to do the surgery.
Okay.
So then when they come, most of them, for the major surgeries, are quite involving surgeries, they'll be admitted the day before the surgery, and then one anesthetist who will be in theatre with them will come and see them on the ward, make sure that everything is in order, and then at that point, the patient can also ask some questions if you are not sure of anything, and then the procedure can be explained to them again. So that just to make sure that because sometimes they might forget at clinic what was said to them. So it's explained again the day before surgery. So on the day of surgery, when we go in, as I said earlier, we prepare the theatre, the parts that we are involved in, we prepare them, and then we send them in. They are sent in, then we give them the anesthesia, and then we stay with them throughout. So when patients are having a surgical procedure, we don't give the anesthesia and then just leave them and then go and sit somewhere and come back. We have to stay with them, make sure that everything is fine. Any problem they have, we deal with it. Then afterwards, after the surgery is over, we decide, they usually go to the recovery ward, which is just around the theatre. If maybe something happened in surgery where they would need ICU care, they'll be sent down to the ICU. So we also decide where they go after surgery. Then once they've left, so that there are recovery nurses, ward nurses there who would monitor them. If everything is fine, they call the ward for them. So and once they go down, if the person goes down to the ICU, then the ICU team takes care of the person. So our point of contact usually with this is the elective cases, will be from the clinic. And then for the emergency ones, it will be when they come to the theatre. And then our care ends when a patient who has recovered from anesthesia, so everything is fine. They leave the recovery ward. After the recovery ward, we don't continue on the ward.
Unless, of course, there's
the person goes down to the ICU, then the care continues until
Looking at how I wouldn't want to use the word complex, but it's actually pretty complex. The work of the anesthesiologist it means that it will require years of training. How many years does it take for one to become an anesthesiologist? If you can run us through that.
So you can actually begin your training during housemanship. So after medical school, we have 2 years of housemanship where you are doing.
What is housemanship?
So housemanship is where you are working under supervision.
Is that a qualified medical doctor?
Yes.
Fresh
So
out of medical school?
No. So yes. So a doctor who are just medical students who has passed their final exams and has been inducted into the Medical and Dental Council. So that person works for 2 years under supervision, and they do 6-month rotations in the major fields. So medicine, surgery, obstetrics and gynecology, and then pediatrics. Yes. But in our last rotation, that's the 4th one, the last 6 months, there's the option of swapping the surgery, the discipline that hasn't been done yet for anesthesia, or the medical one that hasn't been done yet for psychiatry. So there's that option. So if the doctor decides to go for the anesthesia option, their training actually begins from housemanship. Yes. But after housemanship, it's still possible to work with anesthesia. So there's the residency program, which is for 3 years. And then afterwards, once you've passed, you become a specialist. Then there's a membership program for 2 years where you become a consultant after.
A membership or fellowship?
Fellowship.
A fellowship program.
Sorry,
a fellowship program. It's for 2 years.
For 2 years, yes, you become a consultant.
Or it could even be more. Could it be more?
Yes.
But at least 2 years.
Yes, at least 2 years. Yes. So the thing with anesthesia is, for us, the physicians, the doctors, so there are some doctors who do not specialize in anesthesia, but are certified to give certain anesthesia, do certain
anesthetic procedures.
Yes, that's what we call the diploma.
The diploma.
So you have a diploma in anesthesia. So some people can rotate.
And that brings to mind Dr. Jojo Nyamiche-Beidu, who is an Odadee. Yes, an Odadee who also has a DA, a diploma in anesthesia.
Yes.
Sorry for cutting you short, but I just remembered him. I needed to mention his name.
Yes,
he'll be on the show one of these days. A big shout out to you, Dr. Nyamiche-Beidu. Jojo.
So doctors from other disciplines, so like surgery, for example, surgery, and then child health or pediatrics, they will get to work with us for a certain amount of time. And then they would then do the diploma, they'll write the exams for the diploma. So at that point, they are not anesthesiologists, but they are certified to provide certain anesthetic techniques like managing the airway, what we call putting the intubation, putting the breathing tube down, and all those things. Yes, so that's another option for those who want to learn anesthesia skills but don't want to specialize as anesthetists. Yes.
How about the certified registered anesthetist? Do you have any idea about their training program, how long it lasts?
For them,
you have no idea.
I don't have any idea.
Okay, so basically what we are saying is that after having completed 6 years of medical school, you have to do 2 years of housemanship.
Yes.
Okay, making it 8 years, and then you do 3 years of membership, right? Making it 11 years. So becoming an anesthesiologist, 11 years of training.
And then a fellowship.
And then if you want to do a fellowship,
yes, at least
that's 2 years. So we are looking at somewhere 14 years. It's important. It's important. I mean, the lives of people are going to be placed in your care. So 14 years of training is needed for you to be able to be entrusted with that responsibility. And on that note, with regards to fellowship, Dr. Kowa recently became a fellow, if I'm not mistaken. Congratulations to you, Dr. Alexander Kowa, an old boy of Presbyterian Boys Secondary School. Sorry, we are not a senior high school, we're a secondary school. Yes. Okay. Yes, so we've just spoken about the number of years, and we are looking about a total of 14 years to be trained to become an anesthesiologist. We want to move on to our next question. We are wrapping up, right? So I know that the Ghana Anaesthesia Society recently celebrated its World Anesthesia Day with the themes medication safety and safe resuscitation. I am particularly interested in safe resuscitation because I have an organization, On-Field Lifesavers, that has taken it upon itself to train senior high school students, junior high school students on cardiopulmonary resuscitation, especially considering the depth of knowledge on this very important life-saving skill. We've already trained some students of the Ministry of Health Basic School. We'll be coming to the Presbyterian Boys Secondary School as well to train some PE teachers and then some selected students as well. Safe resuscitation is actually important to me. What is your message to the public with regards to these two themes, medication safety, safe resuscitation?
So in terms of, so I'll start with the safe resuscitation.
Okay.
So it's very important to learn because most people who collapse or need the resuscitation, they do it, it happens outside the hospital. So sometimes in their homes when they are eating and they choke on food or something like that. So it's very important to learn these skills, and you don't have to be a health professional before you learn how to do certain things. Of course, you're not going to treat the person. You're not going to give the definitive treatment, but you can. There are just basic skills you can give the person, so the person has a chance of survival.
Their likelihood of survival.
And then also once they get to the hospital, having received these if these measures are performed on them, once they get to hospital, it is likely that their outcome at the hospital will improve, and they might even have a shorter stay. Their treatment might not cost so much because the person has already started to improve. Yes, I know a lot of things are costly. So yes, sometimes we receive people who, if these things had been done, they would have had a better outcome. And then maybe their treatments would be less expensive.
So their time of stay in the hospital will be relatively shorter. The number of procedures that have to be done on them is also less. Right. I think there's actually a research by Resuscitation Council UK that says that in countries where lay people, including high school students, are taught CPR, they have a 2 to 3 times improved chance of survival relative to countries where lay people are unaware of this. So that is actually impressive if you look at it. 2 to 3 times the chances of survival. Wow. Okay.
And then in terms of medication safety, some drugs are sold over the counter and some are prescribed. So it's better to, if you are not sick and you don't need medicine, there's no point in taking medicine. So and then also it's also good to know the type of medicine you are taking and what effect it can have on you. And I don't mean to say anything bad about the herbalist, but sometimes some people might be taking what we call orthodox medication, what we doctors prescribe, and then herbalists, and then it makes the condition worse. Yes. And then also for medication safety, for the prescribed drugs, particularly antibiotics, it's always best to follow through with the regimen. So some antibiotics are taken for 7 days, like the amoxiclav, taken 3 times a day for 7 days. So they have to follow through with it. Otherwise, we will get what we call resistance, where the drug no longer works. And then the doctor has to prescribe the next highest drug, which will obviously cost more. Yes, and if there's resistance to that one, so each time there's resistance, they have to keep
going up until you can do nothing.
Yes, and then it will cause a problem for other people because So in terms of medication safety, and also it's best not to give your medication to someone else because you don't know whether they'll have an allergic reaction or not. The person might not know they're allergic once they take it. Yes.
Okay, so you've heard it from Dr. Rachel Osei. This is the message she's bringing to you, our cherished listeners, regarding safe resuscitation and medication safety, which have been the themes of the...
Sorry to cut you short.
Certainly.
One more thing, and also if a person is not happy with their medication, they shouldn't just stop. They should go back to the doctor that prescribed it. If they can't find the doctor, they can go to another doctor and see whether it can be changed or not. And it's best for medications not to run out. Like in the case of those who have hypertension and diabetes, when their medicine runs out, they may not go and buy it. Then they get another episode of the hypertension. They have to start again. So that, and then that's also dangerous because they can have strokes and then they can collapse as well, for example. So that's also important. So
the message is loud and clear from Dr. Rachel Osei regarding the two themes that the Ghana Association of Anaesthetists, or the Ghana Anaesthetic Society, is running with: safe resuscitation and medication safety. So she's making the message loud and clear. Safe resuscitation is important that you all learn how to provide life-saving skills, which is cardiopulmonary resuscitation. And she goes on to add that medication safety is very important. She's mentioned themes about antibiotic resistance. If you are prescribed a medication, please follow the instructions given to you by your prescriber, be it a medical doctor or the approved prescriber who is prescribed those medications for you. If you are not happy about your medications, please go back to your doctor or to any other doctor to see if a change can be made. Discuss your problems with them. It is your right to be given the options when it comes to medication. And this is particularly important for hypertensives. Okay, I've had a few patients who were hypertensive, mostly male, who stopped their medication because they developed erectile dysfunction. So to the men out there, if you develop any form of side effect, erectile dysfunction, whatever it may be, please see your doctor or any other doctor. We are more than willing to assess whatever side effects you may have and then make changes to your drugs to ensure that you do not have those side effects, and also to ensure that the complications that can often result from uncontrolled hypertension, such as heart attacks, such as stroke, which you just mentioned about, do not. Okay, so yes, we've been speaking with Dr. Rachel Osei, who's been educating us on the role of anesthetists in modern clinical medicine and academia. And we have some questions coming in from our fair-haired listeners. One of them is coming from one of our listeners who says, following the spinal anesthesia I received for my cesarean section 2 years ago, I have been having this pain at my back. Is it normal, and what should I do about it? Dr. Rachel Osei.
Okay. So pain after spinal anesthesia, it does happen. I've had a few patients who have had that problem. So the best thing to do is to go to your nearest clinic and then to report it to the doctor. They may give you a referral to the pain clinic, anesthesia pain clinic, and if they are not able to manage it appropriately, accordingly, they will refer to the pain clinic.
Okay, so the pain clinic is a part of anesthesia.
Yes.
So you run a separate clinic called pain clinic for people with pain.
Yes.
Okay. Yes. When does this clinic run?
Usually Tuesday mornings.
At Kolebu?
Yes.
Okay, Tuesday mornings. Okay. So you heard it from Dr. Rachel say if you've had pain from a spinal anesthesia, it did some years back, or even quite recently, just go speak to your medical doctor. If they are not able to manage it, they'll refer you to the pain clinic of the anesthesia department in any part of Ghana. Our next question also comes from one of our regular listeners. He says, my mom has been struggling with osteoarthritis of the knees for the past 10 years. Wow, 10 years, that's a lot. as pain specialist, is there any intervention to provide respite for her?
Yes, there are quite a few.
Okay.
I am personally not at the pain clinic.
Okay.
But she can actually ask for a referral to the pain clinic from her doctor. Kolebu is a referral center. Yes. So she can ask for a referral from her doctor to come to the pain clinic, and then it will be managed for her. Sometimes she may be given injections into the knee, into the knee for the
joints.
pain.
Okay.
She may be given other drugs to take as well.
That can provide a respite.
Yes, but at the moment, that is not really my specialty, so I can't give the best advice. Yes.
Yeah, but of course, there are specialists in
pain.
Yes,
there are specialists in the pain clinic.
Dr. Jablate, Dr. I think I've forgotten the name, but I think there are quite a number of them who manage pain at the pain clinic, right?
Yes.
Okay, so that is the message from Dr. Rachel Osei. If your mom, your dad has been suffering from intractable pain, be it at the knees or the hips, you can ask for a referral. If your primary physician is unable to manage it, just ask for a referral. Go to the pain clinic of the Kolebu Teaching Hospital, of the Comfort Noche Teaching Hospital, or Focus Hospital, or any hospital that provides pain clinic services, and they would assess you and see how best they can help you. All too soon, we would have to draw the curtains on yet another exciting, enlightening, and illuminating edition of Ɔdadeɛ Health Matters, live here on Ɔdadeɛ Radio in the Alumni and Mentorship Center in Presec, Legon. We have had Dr. Rachel Osei, an anesthesia resident with the nation's premier hospital, Kolebu Teaching Hospital, who's been educating us on the role of anesthetists in modern day medicine and academia. I would want to say a very big thank you to Dr. Rachel Osei for availing herself and for coming to provide us with such illumination. And
I also like to say a big thank you to inviting me.
Okay, I mean, we would want to have you on subsequent editions of Odadee Health Matters. Send the word out there. What do you think of our studios, though? What do you think about Odadee Radio?
I think it's very nice. Looking around, it's very nice, quite professional.
Quite professional.
Yes.
Yeah, I mean, Presec always does things professionally. Thank you very much for such lovely words regarding our studios and the project that is Odadee Radio. So from the entire crew of Odadee Radio, from our executive producers, Mr. Eddie Kofi, Mr. Adofening, from our technical producer, Mr. O2, aka DJ Hughes. DJ Hughes, right? I got the name right. Yes, he's been holding us down. From my co-host, Dr. Prince Samuel Nyoma, we want to say a very big thank you to the Odadee Medical Guild who have promoted this show, who have continued to push us to do the very best that we can do. And of course, to Odadee 81 Group, this program wouldn't have been possible without you setting up Odadee Radio. We are grateful, and to you, our fair-haired listeners out there, this program will never, ever be possible without you tuning in and listening. I want to say a very big thank you. And until same time next week, we'll come your way again with another illuminating edition of Odadee Health Matters. Remember, blue is the color, Presec is the name, we are the Blue Magicians, and we rule the world. Have a lovely evening.
Strong, it only cares for joyful giving. If we try, we shall see. In this bliss we cannot feel. There are dread, we stop existing and start living.